Right. I think we'd start now, and people can join us as we move on with the webinar. So thank you, everyone, and a very warm welcome to all joining us from around the world on this World Population Day 2024. My name is Shweta, and I'm the Empower to Plan Program Coordinator at Population Matters, and your host for this event. Let me quickly take you through the webinar structure. I'll start off with a short presentation on Empower to Plan, introducing Population Matters, the Empower to Plan program, and we'd follow that. That'd be followed by presentations from our Empower to Plan partners for the day. We have Path Foundation Philippines, we have Dandelion Africa, and Women for Conservation. During their presentations, you could pop in your questions or any sort of comments that you want to make in the chat box. And we try and get to all the questions at the end of the session. But if you don't get the chance because of time, we'd already have collated them. We'd already have noted all of them down. We try our best to respond to them in a follow-up email. I hope that's okay and makes sense. Okay, perfect. Right. So this year's theme, Women in Conservation, it's particularly special, because we're celebrating the transformative work of our Empower to Plan partners in healthcare, especially sexual and reproductive health and rights, environmental conservation, and climate action, while recognizing the intricate links between population dynamics, health, and a planet's well-being. And before we dive into insights from our international panel of experts and our Empower to Plan partners, let me quickly introduce Population Matters and why we've chosen to spotlight women in conservation this year. Population Matters is a nonprofit that campaigns for and supports positive solutions related to global population growth. Central to our mission and at the heart of our solution, amongst many, is empowering women and girls through initiatives that promote sexual and reproductive health and rights, access to contraception and family planning services, education related to these topics. And it's not only just addressed to women, it's also addressed to men, communities alike. We also focus on positive climate action and environmental solutions. We do this through our campaigns that promotes these solutions, spreads awareness about these challenges. We do it through our research that brings in the scientific evidence that brings more depth into the challenges we're talking about. And we do it through our grassroots funding program, which is Empower to Plan, which supports grassroots organizations, supports community-led culturally sensitive initiatives which acknowledge the unique challenges that is faced by each community, the unique gender and social dynamics in each community. So very quickly, what are the solutions that Empower to Plan really supports? And why are we focusing on the intersection of women's empowerment, gender equality, and environmental health? So a lot of research there's a lot of research and evidence from very prominent organizations like CARE, World Wildlife Fund, which has highlighted the links between gender inequality, biodiversity loss, and environmental degradation. And they've shown and they've consistently said how women's empowerment can lead to better conservation outcomes. And all of our work, whether it's our Empower to Plan partners, our research, our campaigns, they've all been reflecting this reality. They've all been reflecting that the solution works. And today our panel will shed more light on its importance. But before we do that, I'll quickly explore these connections a little more. A lot of evidence suggests that limited agency and inadequate focus on women's empowerment, health, and education, particularly in the areas of sexual and reproductive health and rights, access to contraception, access to family planning resources, and comprehensive sexual education, all contribute to population growth. Now, at no point we're saying that these are the only factors that contribute to population growth. There are multiple other factors. There's policy that influences population growth. There's social, cultural norms. There's economic factors. What happens is this growth increases the demand for goods and services, heightening pressure on the finite natural resources that we have available on our planet, and intensifying the climate crisis we're currently going through. Now, climate change comes with its own set of challenges, right? We've been seeing extreme weather events, we've been seeing increased frequency of natural disasters, all of which impact livelihoods dependent on natural resources, extensively, leading to food insecurity, poverty, and this further undermines women's agency. So you'll see we're back in the loop. We're back to women's agency, and we're not trying to oversimplify the problem at any point in time, but we're just trying to depict at how these problems are interconnected, how these challenges are interconnected. There's every problem, every challenge leads to another problem, and you have to look at it holistically. So the issue is complex, it's very dynamic, it varies across regions, across countries, and across communities. They're very different, and there are several other contributing factors and effects. Each area is interconnected, and they cannot be viewed in isolation. Now, given these challenges, the role of women in conservation becomes even more crucial. The Food and Agriculture Organization reports that women comprise almost 40 to 45% of the agricultural labor force in developing countries. And I've seen that while working in India in the rural development and agriculture sector. I've seen how women are a very active part of the value chain, but they're often unrecognized. Their efforts, their stewardship is often unrecognized. And their role is extremely crucial in maintaining biodiversity and managing natural resources sustainably. Now, not only agriculture, take any livelihood that is dependent on natural resources, let's say forestry, fisheries. Women's stewardship often goes unrecognized, and they're frequently excluded from decision making. This perpetuates the unequal power dynamics that we keep looking at, the marginalization. And like I've said before, research has revealed that empowering women in natural resource governance improves conservation outcomes, and our partners will say it today. There's evidence from the ground. So when you place women at the heart of conservation efforts, you empower them, you sensitize communities about their roles, you're directly involving them in conserving the environment which impacts their livelihoods. This enhances their agency and rights and leads to improved conservation efforts and outcomes. Now, like I said, it's not easy. We're not trying to oversimplify this. It's very difficult. It's not a straight line equation. There are multiple factors that come in. Even when you go to implement a project, there's the policy, and there's a policy environment, there's the community dynamics, there's social and cultural norms that are present, and our Empower to Plan partners work tirelessly to tackle all of these barriers that may be existing towards a more equitable future, towards a more fair or equitable future for our planet. So that's what Empower Plan supports. We support these grassroots organizations who are working day in and day out to address these challenges holistically, because they truly understand and acknowledge the challenges the communities face. They design and tailor the solutions that are culturally sensitive. It's truly a bottom-up approach that supports women's agency, gender equality, and promotes contextualized climate action. And these are the solutions we're looking at. And Empower Plan focuses on its access to quality healthcare, especially in sexual and reproductive health and rights, family planning, access to contraception. It's access to quality education in these areas, empowering and also supporting environmental stewardship and climate action. It's empowering women, girls, and communities with the information, knowledge, and choice to exercise their reproductive rights and support planetary health and well-being solutions. And we've been extremely lucky. We've been extremely lucky that we've had the support of such incredible partners over the past 6 to 7 years who've been working very, very hard to amplify voices from the ground, to promote these community-led solutions which promote choice, which are rights-based, and and where we're trying to create a world where conservation and human well-being, and women, they're all of human, we are living and we're thriving in harmony. So that's the idea. And I think what makes Empower to Plan special is that none of the solutions are dictated or they're prescribed. It's not a one size fits all. They are by the community for the community. So uh, I'll leave it at this. And today we are focusing on our three partners. That's Path Foundation Philippines, Dandelion Africa, Kenya, and Women for Conservation, Colombia. I'll quickly introduce our first panelist. We have Dr. Joanne Castro, who is the Executive Vice President at Path Foundation Philippines, who has over 20 years of experience in sustainable community development initiatives, particularly in integrating population health and environment approaches, that's the PHE approaches. Joanne has worked with international and national organizations, both public and private sectors, in health as well as in sexual and reproductive health and rights, advancing an integrated PHE approach, which has been a subject of many of her publications. Currently, Joanne leads Path Foundation Philippines, a non government organization whose mission is to alleviate poverty, improve health, and promote environmentally sustainable development. Since 1992, PFPI has pioneered innovative approaches and designed, implemented, and evaluated cutting edge projects in family planning, reproductive health, and cross sectoral initiatives by integrating population health and environment. She's also our change champion for lifetime achievement this year. So, congratulations, Dr. Joanne. And I'll stop sharing my screen. And we really look forward to your presentation and all the good work that Path Foundation Philippines has been doing over time. So, over to you. Thank you.
Hello, everyone, and greetings from the Philippines. Thank you, Shweta, and thank you, Population Matters, for the invitation to join this discussion. Thank you also, everyone, for being here and being interested in the work that we do. Shweta has already described what Path Foundation is all about, but please allow me a little bit to share with you. We are a non-government organization, as mentioned. We are 30 years old already, and we have implemented various programs, both sectoral projects on HIV/AIDS and STI prevention, WASH, fisheries, environmental conservation, and cross-sectoral initiatives applying the PHE approach. And the graph that you see on your right on your left would be the various work that Path Foundation Philippines has implemented over the past 30 years. Let me start by introducing to you the Philippines and the state of affairs related to population, health, and environment. The Philippines is an archipelagic country with one of the longest coastlines in the world. It's recognized as the most biodiverse in terms of its species biodiversity and both terrestrial and marine. And over 65% of the over 100 million population live along the coast and dependent on the resources for food and livelihood. Our population is expected to reach close to 140,000 million by 2055 with the current population growth rate. 1/3 of our population is under 15 years of age and will be reaching their population reproductive age in the next 5 to 10 years or so. And while the number of live births in the Philippines is on a general decline, teenage pregnancy is high. It's one of the highest teenage pregnancy among the Southeast Asian countries, and with more than 500 adolescents becoming pregnant and giving birth every day. 1 of 4 is also considered poor and higher, particularly among the communities that we work. That's the fishers and the farmers. Undernutrition is and has always been a serious problem in the Philippines. For nearly 30 years, already, and this is like is quite an irony because we have a very rich natural resource which people depend upon for food and livelihood. The country is also prone to natural disasters with almost 20 tropical cyclones per year that's causing flooding, storm surges, and erosions. It is in this backdrop that the PHE makes sense. The intrinsic links between the state of the resources and the health of the people is undeniable. One of the pioneering PHE projects that PFPI implemented was called the Integrated Population and Coastal Resource Management Initiative. And we use a symbiotic strategy to link sectors like population, health, and environment in targeted high population growth, particularly marine hotspots. We focus on food security and promoted family planning and reproductive health as a strategy to reduce fishing efforts and improve well-being. So if you notice, the pictures actually depict 4 strategies that we've implemented. Community-based family planning and reproductive health at the community level in small convenience stores that are run by families. We also implemented coastal resource management initiatives with people's organizations, and we did IEC and policy advocacy and provided alternative livelihoods, particularly those who were affected by the establishment of marine protected areas. At the end of the project, and that was 7 years, we were able to work in over 1,000 fishing communities with close to 1,000 peer educators and community-based distribution centers. We also published peer-led paper that showed evidence that integrated approach yields larger impact on human and ecosystems health and food security compared to single sector approaches. And I believe that up to this time, that's the only well-studied document or publication that we have as a reference to date. The lessons that we've learned from the IPAP Forum was replicated in a project called Balance. It's building actors and leaders for advancing community excellence and development in Africa and in Asia, in these countries that were considered high biodiversity areas. The project promoted wide adoption and use of effective PHE approaches globally by building PHE capacity with institutions and individuals, and by establishing state-of-the-art PHE knowledge management materials and scaling up of field PHE implementation. So you find the link where those materials are. At the end of the Balance project, and this was a 5-year project, we built the capacity of 21 community-based organizations who are either working in marine, agriculture, watershed, forest conservation on PHE approach in 8 biodiversity-rich countries, and that they were able to integrate family planning and reproductive health programs into their existing programs. And the services that we provided were enabled the communities to have access to FPRH health environment services, even in remote communities. The PFPI also had project focused on women to better understand how we can plan and design projects and advocate for women's issues. We did a scoping study in one of communities to gather the perspectives of women, fisher folks, and policymakers on PHE and climate change, and how sexual and reproductive health and PHE and climate change are linked, and why they should be integrated, including what actions and policies are needed to enable women and fishers to become resilient to climate change. We listened to stories of women, their expression of concern about climate change and the future of the next generation, particularly the poor, the women, and the children. It was very interesting to note that majority knew what climate change is all about. They don't have a local term for it, but they say they're experiencing it. The study highlighted that those with large families will be affected the most, and those with low and no stable income, and the additional burden is placed on the women as a result of climate change, having to work harder and longer to augment their family's income. And this was clearly described in the story of Jovita, who is the wife of a fisherman who, when we interviewed, was then 37 years old, pregnant to her 9th child, concerned that there is this declining fish catch because of climate change, and that she has to help out by weaving nipa shingles. There was more to the story that we listened not only on Jovita Ramo, but many other women that we talked to. We also had a project, or PFP had a project called Twin Bakaw. It's short for Bakawan, which means mangroves. It's a project that applied the PHE approach to advocate for gender equality and sexual and reproductive health and rights within indigenous populations. The idea of the project was that each newborn in the family will have a twin mangrove seedling, which the newborn's family must plant and nurture until it's fully grown. So it's also an indication of what stewardship is all about, starting even when the baby is born. At the end of the 10-month project, we were able to reach more than 100 indigenous people fisher families who were trained to educate their peers. They were able to establish 45 hectares of mangroves as women managed area and a twin Bakaw zone approved through a municipal ordinance. And the women were able to plant 10,000 mangrove propagules over the period of time of the project. The other project that I'd like to highlight is the Empower to Plan project. It's the most recent and the 12th women managed area established by PFPI since the first indigenous people WMA was established in 2018. The project was implemented with support from Population Matters, and in less than 6 months, a women's group was organized who now manage a mangrove area of 25 hectares and established a nursery and planted over 1,000 propagules of mangroves. And with a group, about 36 women were trained on family planning and reproductive health and on PHE. So they are now able to reach other community members and their peers and encourage their youth to manage their resources. For decades of work that we work in PHE, we have some lessons learned, and that affirms the relevance of the PHE approach. Among them, that PHE can be scaled up and replicated in various contexts, and there is no downside to PHE integration. The approach promotes community empowerment, and that integrated approaches encourage more women and youth participation in conservation, and there's greater access of men and women in family planning and reproductive health services. The other lesson is that community says the PHE approach reflects the community's way of life. There's a lot more to do. The issues are complex and dynamic, as Shweta has mentioned earlier. We have effective models and approaches that we can replicate and scale up to reach more women, youth, and more communities who need our services. But easier if together we face the challenges of the times. So if you're interested, you'd like to know more about what we do, or you want to do something, please feel free to contact us, and we will welcome you with a smile. Thank you very much, and good day, everyone.
Dr. Joanne, thank you so much. would you mind to stop sharing your screen so we could be visible? Thank you. Thank you so much for such a lovely presentation. It was really insightful. I was lucky enough to visit Philippines and see the direct impact of the project we funded. And it the challenges that face Philippines makes PHE a very suitable approach, which really keeps women at the heart of the initiative. So thank you for all the good work that PFPI is doing. And, you said that to me with Mayor Tribe Group. Um, we quickly move on to our next panelist, that is Isabella Cortes Lara, who's the CEO of Women for Conservation in Colombia. Isabella is a dedicated conservationist and artist with over a decade of experience working in the Sierra Nevada de Santa Marta region. Her work is featured in the book Intertwined: Women, Nature, and Climate Justice, written by Rebecca Cormos and endorsed by Jane Goodall. Isabella is a passionate conservationist and artist with a Master's of Science degree in Conservation Project Management from University of Kent in the United Kingdom. As the Executive Director at Women for Conservation, she has spearheaded numerous community engagement initiatives, blending her expertise in conservation education with a passion for art and murals. Isabella has the great honor of a new species of hummingbird named after her, and please correct me my pronunciation if I'm wrong, but it's Eriopnemis isabellae, yeah, which is listed on the IUCN Red List as critically endangered. Isabella has been pivotal in empowering local women through hosting seminars, workshops, and conservation training, sustainable livelihoods, and family planning programs. Her innovative approach includes organizing community murals and educational workshops, which have raised awareness and inspired grassroots conservation projects protecting dozens of critically endangered species. Isabella's deep connection with the Kogi community and her commitment to fostering local conservation leaders have been instrumental in promoting sustainable practices and protecting the region's unparalleled biodiversity. She continues to inspire and drive positive environmental change within rural Colombian communities. Thank you so much, Isabella. And also, Isabella is also a Population Matters Choice Ambassador and has featured in our latest spring magazine. So if not read it, please go ahead and read it. It's a very good piece. Thank you so much, Isabella. And for agreeing to share your experiences with us. We're truly looking forward. So I'll hand it over to you.
Thank you, everybody.
Isabella, I think your voice is very faint.
Can you hear me better?
Yes.
Thank you so much. I'm honored to be here, and I'm going to share my screen. Okay. Let me try again. Share sound. Oh. It may not let me. It's not letting me. Hold on.
It's not letting you. Ben, do you want to have a look at what might be causing this? Okay, I think we'll wait for a minute. I think Isabella's trying to log back in. We'll wait for a minute. I think Isabella's trying to log back into the meeting. Just give us probably 20. I think, yeah, she's back. Isabella, your sound is a little.
Can you hear me
No,
now?
it's quite faint.
Can I share my screen now and see if that works? Yep.
We can see your screen.
Great. Let me try and this. And
there you go. You can see your presentation. So I'll switch off my video and mute myself.
Yeah, maybe that way okay. Can you hear me better?
Yes.
Great. So hello, my name is Isabela Cortez Lara, and I am the Director of Women for Conservation. But the person who started this mission really is my mother, and from her, my grandmother. So I'm the third generation of conservationists and community leaders that has taken on this mission. So like I mentioned, our mission is to protect biodiversity and very important areas that are important birding areas, that are KBAs, key biodiversity areas, and that are extremely important for endemic species, which Colombia is one of the most important areas for conservation because it has the highest level of bird species in the world, including my species, Erocnemis isabelae, which is from a very rare area in Cauca, which is the southwestern part of Colombia. So our mission begins with Amparo. Amparo is my grandmother, and she was a woman that fought for women's rights. She was a leader in her community during one of the most violent eras of war, and she had to withstand conflict as well as trauma and abuse from her own partner. She comes from a very machista society and also from a region that is indigenous mostly and campesino. This is her picture here. She would travel 2 hours daily on a mula or on a burro to go to different areas, and she would work hand in hand with women who were living situations that were awful as well. They had to withstand some of the worst poverty, and also, of course, conflict hit mostly women during this period because of losing their partners, being displaced, losing their children to recruitment, and many other issues that happen during conflict. So women have always taken on the burden of carrying families and being mothers and of having to have children during some of the worst conflict. So Amparo began this, and unfortunately, she died very young, and she died when my mother was only 19, so younger than me. And my mother took on her lessons and started to begin forming Women for Conservation through bird conservation. And she's one of the founders of Fundación Pro Aves, which is the largest organization in Colombia and protects 27 nature reserves, which totals over 60,000 hectares of forest, of rainforest, of Chocó, of Amazon basin, Sierra Nevada, and many other regions throughout the country. And that is where I come in. And with the third point, we started Women for Conservation through family planning with a PHE approach, a holistic approach. And we see this as one of the top solutions because women are disproportionately affected by climate change and have been subjected to many different issues, including education, access to education. So not only is conservation important in these areas, but involving women in capacity building and training is essential because most women from these communities are stop going to school at 15 years old because they have already had a child or they are waiting to have one or pregnant. And many girls drop out of school. So that became a really big issue with me involving different women and girls in projects because what we saw is that we had low participation because women were restricted to being at home with their children, and that really was a setback. So we started a program that had various reaches in different areas, and also we talked to schools and we had psychologists who were trained in different topics come talk to the girls. And so in this picture, I am with one of the psychologists from Pro Familia, which is another organization which we partner with that has these brigades. So it's a very integral approach where we also take in mental health and well-being. And our approach incorporates these 3 pillars. We have nature conservation. As I mentioned, we work in KBA areas and zero extinction alliance places, as well as we work around regional and national parks, as well as private nature reserves, which is one of the main areas, for example, that there are maybe 20 individuals of a bird species or 60 on the brink of extinction and needs urgent conservation actions that will enable its preservation. For example, we work with reforestation and restoration in different varying manners with viveros, as well as with planting trees and brigades with different forest guards, and in alliance as well with indigenous communities, because there are many indigenous communities around these areas that are integrated through these different activities. Then we consider the health of communities for healthy habitats. We believe that a community needs to be in the position that they can help themselves to be able to help the planet. So this is essential with family planning, but this doesn't restrict only to women. We work with men as well. We do clinics where we talk about sexual reproductive health. We talk about STIs. We talk about different methods. And also we have, as I mentioned, psychologists to talk about violence prevention. Because unfortunately in Colombia, the 3 main leading causes of death for women is cervical cancer, breast cancer, and domestic violence. So we have those cases where we need to give women these tools. And of course, by giving women tools and opportunities to create livelihoods for themselves, we're also reducing the pressure on goods and services, and that is done with sustainable livelihoods. So as you can see, I have all of this jewelry on. This is part of the project. This is from the Emberacatillo community. The picture here, this is the indigenous community that this comes from. And we have multiple projects and multiple sites that work on creating these different items and artisanal products that help sustain women. This also includes sustainable coffee farming practices, as well as trees, fruits, and many different products that come regionally and locally. These are our project sites. I am primarily working in number one in El Dorado, but we are moving and constantly working in all of these different regions, including the Amazon basin, the Chocó bioregion, and the Andes. These regions are all incredibly diverse. They all have their own ecosystems, and they are varying in altitudes, in temperatures, and also in species. We work with multiple endangered species, critically on the brink of extinction, as well as endemic species, which are endemics meaning only from one area, unique in their own class. So I'm very excited because we've recently started Mujeres en la Ciencia, which is a scholarship program that we have for women, and that has given us amazing projects that include El Jaguar and the bottlenose river dolphin, multiple amphibians, as well as tortugas, turtles. So that has given us research from these areas, and also in these areas we're doing family planning. So this varies from region to region. Right now there's more activity of family planning in La Sierra Nevada de Santa Marta, which is number 1, but we have it in the different locations. So this is very impactful, and these numbers, we have worked with our blood, sweat, and tears to be able to produce this result. It's been extremely difficult because we have multiple layers, multidimensional layers of difficulties. Not only do we come from a machista society where in many cases women are in some kind of submissive role where they have to ask for permission, or they have to go with their husbands, or for example, their husbands don't agree, or there's differences, for example, that women have less opportunities and less financial stability. So family planning makes that extremely well, it varies from family to family. So implants are 5-year implants that we do on brigades, and we also do tubal ligation, or also we call it pomeroy. So that is very exciting because we also have men. Men are involved in our process. They are integral in making change. We depend on men as well on our programs, and we have multiple men that have been so kind and loving towards their families. You can see their videos on our YouTube on how they have come forward and they have decided to take the step themselves and take responsibility for their own family planning. So that's very heartwarming, because when we began these different processes in the community, it was really difficult and men didn't want to participate. So when my mother began the first family planning brigades almost 20 years ago, well, men didn't want their women to participate at all, because they were concerned that they would be replaced, and that, you know, that isn't for machos, that vasectomy would basically make you not work in bed, and all of these different things that really stigmatize the whole premise around talking about sex and talking about family planning within the family, of who gets to decide of what method to get. And it was a big challenge, and it was a steep uphill slope for many years. And this is one of the best results we've had so far, because men are talking about it and they're convincing each other that this is a good thing to do for your loved ones. So our work, my work specifically is in La Sierra Nevada de Santa Marta. I work in one of the biggest coastal mountains in the world. I have a big motorcycle and I'm running up and down to different communities, indigenous communities. And we are so proud because this is one of the main areas that has been hit with conflict, with armed conflict for the past 50 years. Colombia has a peace treaty, but that doesn't mean that everything is perfect, because in these regions, there's still a lot of complicated issues politically that affect people day and night. So this was a picture from our last brigades. We are leading multiple brigades in these areas. We've already done 3 so far, which have been met with success. We've had women coming from 4-5 hours. This is a really remote area that you have to go up in a 4x4 vehicle, and that 4x4 vehicle is very expensive costing, because there's the dirt and terrain is just ridiculous. So being able to carry out these projects, you depend on community leaders. So these are the community leaders that have helped me in the sense of making this project work, and also children that have been so integral, because we work with the entire community. I personally lead workshops and different activities within schools, within the indigenous community, and we have for this example, this mural that was made so that it would attract tourism for this species called the blue-bearded helmet crest, which is one of the most critically endangered hummingbirds in the world. So why are we doing this? We are doing this for women that are constantly leading forward the next generation, and we want to plant seeds of development and also of conservation in these areas. We want to be able to help women get the opportunities to be able to bring their families forward and to sustain their families, because climate change is really affecting everyone right now, and that is a fact, and women are carrying it. And also because we want everyone to be able to finish on their different projects in these areas, and we want children that are on their way to have a healthy support system in their community, and also we want women and their pregnancies to be safe. So our call to action is to please support our campaign. We are campaigning to fundraise for 100 or well 75, but 100 women. And we want to be able to attend the women that are on our waiting list, because we have multiple areas and there's a lot of demand for this, because family planning in these areas is just not accessible because of the distances, because of the opportunities, because of the rurality, and because we have so many women that are coming from a different perspective. And that includes environmental education, that includes educating them on their rights. So this is a multifaceted project that obviously demands. So thank you for any support. And in honor of World Population Day, today we're hosting a brigade in Colombia, in La Sierra Nevada, Santa Marta, in the city of Santa Marta. And we are very happy because there are so many women that are able to become involved. And thanks to Population Matters for giving us this platform and for all of the help that we've gotten from our partnership. So thank you so much.
Thank you so much, Isabella. I think we have to thank you more than you have to thank us. So that was a very, very good presentation. I think the challenges that you highlighted are, they're there, and they're not going to go anywhere very soon and unless we do a lot of sensitization programs, have a lot of behavior change programs come in, and that's the toughest part. So thank you again, and we really appreciate all the time and effort you've put in, and both you and your mom actually, because it's like you said, it's a legacy that you're carrying forward, and we wish you nothing but the best, and we hope we can partner again. Moving ahead, we have Wendo Asset, who's the founder and executive director of Dandelion Africa, a grassroots innovator in Kenya that focuses on sexual and reproductive health for women and girls, economic livelihoods, and advocacy on gender-based violence through men's engagement. She has over a decade of experience in sustainable grassroots programs that is rooted in community-driven solutions. Through Dandelion Africa, they have set up over 50 reproductive and maternal safe spaces and built 3 health centers and 2 libraries. She has studied at various institutions, including Strathmore College, as part of its executive program for nonprofit leaders at Stanford University. Wendo is an African Visionary Fellow, a Rising Star Awardee of 2017 by the Siegel Family Foundation, an Aspen New Voices Fellow 2019, and a recipient of the Kenya Presidential Award in 2022. Her work was recognized by Bill Gates through Gates Notes in the same year. She serves on multiple boards, both locally and internationally, and consults for nonprofit philanthropists on local and grassroots-driven initiatives. Wendo is also a member of Population Matters Expert Advisory Board and was also Change Champion in 2021. So thank you so much, Wendo, for being here with us today, and we're looking forward to your presentation. I'll hand it over to you now. Thank you.
Thank you very much, Shweta. My name is Wendo Asset, founder and executive director of Dandelion Africa. Allow me to share my screen. Hopefully the internet works. Shweta, please let me know if you can see my screen.
Yes, I can see it. Do you want to go in presentation mode, Wendo?
Is that better?
Yes, perfect. Thank you.
Thank you. Thank you so much. Great. So good evening, good morning, depending on where you are in the world today. Today, I'm going to talk about Dandelion Africa, a grassroots organization that is based in rural Kenya. We work in the arid and semi-arid regions, and we do that very, very intentionally. Our mission is to improve the health and livelihoods of women in this particular region. As you can see, I serve a very beautiful population. Now, Dandelion Africa being a female-led Kenyan NGO, focuses on women's health and economic empowerment, as I have said, and we work in the rural areas. As you can see on the map, we specifically focus on arid and semi-arid strips because the challenges facing women and girls in this particular region are very unique to populations and communities that experience droughts, and when there is a lot of rain, they experience floods. So today we're going to have a conversation about our similarities. And as you're sitting where you are today, I want you to look at these two photos. And the question from me is asking you, what are our similarities? What are the similarities between us on the backpack nurse, on a dry road in a sisal plantation in rural Kenya, and you sitting wherever you are around the world, whether it's in the UK where population matters is, whether it's where Shweta is, or whether it's in America or wherever it is, what are some of the similarities? And the reason I'm asking this question is because half the time we always ask ourselves, what are our differences? But in this conversation today, we're going to ask what are our similarities. I guess I'm going to answer that question because there's no opportunity right now for you to respond. Our similarities are simple. Time is money. So the reason time is money for us is because it's the reason why we exist. In Kenya today and where we work, 4 million Kenyan and girls have experienced female genital mutilation or female genital cutting. 7.8 million Kenyans live in poverty, and majority of these live in rural areas. As you might know, in Kenya, 68% of our population are based in rural communities. Over 13,000 teenage girls drop out of school annually because of pregnancies. This actually translates to early marriage and other cultural impediments that hinder girls from achieving their full potential. 70% of women and children lack access to appropriate healthcare, making it the greatest need for women and girls in our community today. So one of the things that is Dandelion's special sauce is how we work around our operating model or our integrated model. Our community needs are very specific, and we face multidimensional challenges like Isabel and Dr. Joanne have spoken. You will note that communities need different interventions to be able to take care of their needs and to be able to come out, either to come out of poverty or to look after themselves. This is not different for Dandelion Africa. I'm going to discuss with you very briefly on our operating model, and I will delve deeper, especially on our healthcare as we progress. So this is how our operating model looks like. At the center of every community is what we call the backpack nurse site. So this is what we actually create, something like a McDonald's or a KFC franchise model, where in a community that is 20 to 30 kilometers away from a government facility, we either build or we rent a place where our communities can access family planning, they can access maternal child services, that's immunization, ANC, postnatal, HIV testing and management, health education, amongst other things. And this, we have 50 such sites across 4 counties. Now, once this facility is running, a nurse on a motorbike will go from the link facility to the backpack site to offer these services. Now, you might ask yourself, how do communities know that a nurse is coming? We work very closely with over 2,000 community health promoters, and these are called different names in different countries. Some call them community health workers, promoters, volunteers. But the gist of it is these are people in the community who are trained, and they do a lot of mobilization to bring women and girls to these safe spaces where they're offered particular services, and ours, at the core of everything, is reproductive health. Once this has matured, maybe after 6 months to 1 year, we introduce the Women Livelihood Program. And this brings me to the point of time is money. Most women in rural communities do not have time for productive work, because just like Isabel's region, we have to ask for permission about the number of children that we can have. We have to ask for permission about the money in our pockets. We have to ask for permission whether we can get jobs or not. And so it is critical that when women have access to reproductive health or family planning products, we introduce them to savings and borrowing and entrepreneurship skills so that they can make money. Because at the end of it all, when women have no access to financial independence, it becomes very difficult for them to put money aside for their children's education, for their leadership opportunities, for their health and the health of those of their children. So that is where we go next. After that, we engage the youth program. And this is where Empower to Plan really came in strongly, where our Girls for Leaders, Boys for Change program is a program that creates opportunities for education for both boys and girls. And at this point, the girls, we only work with schools that perform the poorest in the region, because personally, coming from an environment where I didn't even know I would go to school, I am an example that shows that it is possible for girls to succeed in life if they are educated. We engage the boys because that is the special sauce. We can't talk about gender equality when we are only talking about one gender. And that is why it is important for our Boys for Change to be trained on menstrual hygiene. They are trained on eradication of female genital mutilation. They are trained on contraceptives, and they have become the biggest champions that have propelled the project and the program of the Girls for Leaders, Boys for Change program to the level where it is recognized in most regions currently. Now, how do we ensure that communities are sustainable? That brings in our advocacy program, where communities are trained to lobby for resources within their communities. Half the time you will note that rural communities, sometimes the government might think that they are not educated, so they don't know how to read county or district budgets. They don't know how to read national budgets, but things are changing. As you have seen in Kenya right now, people are taking to the streets because of the finance bill, for example. And this advocacy program is critical in people understanding what the government has to offer. So a community, for example, in a place, for example, here where I'm sitting right now, called Majani Mingi, lobbied for a health facility. They lobbied for boreholes. They lobbied for electricity. And that's the future we want, where communities have the power to advocate for themselves, so that organizations like Dandelion can then move to other regions where help is needed and start all over again. Now, when we finish, we partner with like-minded organizations. We mentor local community-based organizations on our model, and we get out of the way, let them use their voices to empower our communities. Now, I'm going to delve a little bit deeper on our backpack nurse and maternal shelters. As you can see, these are communities that are in a very arid area near Kilimanjaro, Mountain Kilimanjaro. Community health promoters identify the needs of communities by visiting every household every month. The women in our communities are the ones who build maternal shelters, because men are not allowed to build these kinds of shelters. They decide what they want for themselves. And in our area, Dandelion has constructed 3 medical centers that focus on the well-being of women and girls in providing reproductive health that is dignified. When women build these kinds of shelters, especially like in this region in Kilimanjaro, this shelter was converted into a postnatal clinic, because we built a hospital using shipping containers, because we are right in the middle of a national park. This shelter is not only used as a postnatal clinic or a postnatal center, it is also used for reproductive health, so that young girls or women, when they come to deliver here, they're able to get postpartum contraceptives, they're able to get health education, and they're able to make informed decisions about their lives and about their reproductive health. One of the things that Dandelion has invested a lot in is understanding the relationship between education, economy, and conservation. In our women In our women program, for example, we teach women to save and borrow their own money. We teach them about business opportunities. And as you can see here, these women are able to save a lot of money as a collective. Women like Naisieku here, who is also in one of the groups, has been able to buy a water tank because she wants to start smart farming in her community that is extremely dry. And in this community, where they are pastoralists, they do not do farming, they are among the first women to start planting trees and to start smart agriculture in the small spaces that they have. Jane, on the other hand, has started her small farm because she wants better nutrition for her children. And this is done through the Women Economic Empowerment Program. Now, it is critical to note that the involvement of boys in menstrual hygiene, in reproductive health, is critical in breaking the barriers between genders. Our staff here is talking to communities and talking to girls about menstrual hygiene. This is critical because we have seen when this program started in 2014, for example, only 45% of girls would transition from primary education to secondary education in our region. Today, we are talking about 98% transition because of the engagement of boys. Because when a girl soils herself, a boy can get a sweater and say, here, I'm going to the staff room to get you sanitary towels. And there is no shame talking about menstruation. It is boys who champion for the rights of girls and women in our communities. And that is what has helped the impact that we are currently seeing. When this happens, when women have time and they have money and they're able to do all this, we see the issue of climate mitigation showing up, where young women are coming in the forefront to champion for climate action. Education then improves significantly because women have money and communities have money to educate their children. And you know what research says, and what we have seen even in my community, that when you educate your children, this is one of the strongest ways and the most strategic ways for communities to get out of poverty. Now, our impact is, as you can see, currently we have 96% transition. That is in 2023, and in beginning of 2024, we were at 98%. I'll drop a little bit down here from 2019 to 2023. Over 100,000 women access long-acting contraceptives in the 4 counties that we work with. We work with a population of about 1.3 million people. 85 schools enrolled in the Girls for Leaders, Boys for Change program. And in our 3 facilities, we had 1,537 skilled deliveries, which was usually not the norm because majority of the women delivered at home. And that increased also mother-to-child transmission of HIV. Over 7,000 women are in saving groups and have doubled their income. And most importantly, 30 villages of our intervention have been declared FGM-free. Now, I know you wonder why we are where we are. We are deeply engaged in our community. We listen to our communities. There is nothing for us without us, and that is the ethos of Dandelion Africa. We have proven impact, and we work very closely with communities because they are the ones who come up with strategies that improve their health and economy. Now, this year, we have so far trained over 1,000 community health promoters, 78% who are women, on using digital tools to collect health-related data using what we call the ECHIS platform, or Electronic Community Health Information Systems. Now, in rural areas, certain systems might not work, but not for us. We want to be able, as a community, to make development plans, but we can't do that when, as a continent, we are not collecting accurate data and are leaving some of our communities behind, including people living with disability who cannot be reached, or communities living in extreme poverty and living in extreme rural areas who are not captured. How can a country make plans about their development when they don't know about the needs of their communities? So today, my call to action is to ask governments and to ask all of you to help us invest in systems that include and involve everyone. And this can only be done when we know our strengths and weaknesses, when we invest in data. This means that everybody counts and no one will be left behind. I want to thank Population Matters for giving us this opportunity, for supporting us with the Girls for Leaders, Boys for Change program, because without them, we would not be seeing the kind of impact that we are seeing today in our community. Support Dandelion Africa. Reach out to us through our email. You can have a look at our website to see the kind of work that we are doing. And thank you so much for being here today to listen to this presentation. Thank you, Shweta and Population Matters.
Thank you so much, Wendo. That was genuinely a very, very good and very insightful presentation. It was very, very interesting to learn the kind of challenges and the regional and the geographical aspects that come into play. So very quickly, we have a few questions that have come in from our audience. Quickly, just give me 1 second. Anyway, right. So the first question, and if we can keep it brief because we're short on time, then we can maybe take 2 questions up. But this is something that all of you covered. But community support is extremely crucial, especially with your existing social and gender norms. How do you get the whole community, including men, on board to make sure the programs that you're implementing, which include women's empowerment, family planning, sexual and reproductive health, which are mostly taboo topics, and how do you get them on board, the whole community, including men, to make sure these initiatives run smoothly? Do you have any thoughts on that, or would like to shed some more light on that? Maybe Dr. Joanne, would you like to go first?
Sure. We include the community at the start of the project. So involving not only the women or the targeted beneficiaries of the project is not enough if we want everyone to be involved. The women is very important because they also are the ones who rally the other members of their families to be part of the project. So I think that in most of the project, what PFPI does is that we engage the local stakeholders, we engage the local governments, we engage institutions that will support or enable change within the community. So they're part of the whole project from the start to finish, and actually they sustain it even beyond the project life. Thank you.
Thank you. Isabella, would you like to go next?
I think it's really important to create spaces where women can be themselves and can access opportunities in moments where perhaps they've never been able to have that because of the society we live in, the way that many women have to subsist in this way that is asking permission. So I think it's so important to be able to give women the spotlight, but also to give women leadership.
Yeah.
Leadership is the most important. They have to become the engine of the projects, and that is how it becomes successful.
Perfect. Thank you so much, Isabella. That's very helpful. Wendo, any thoughts?
For patriarchy societies like ours, it is critical to engage, not just to engage, but to involve both women and men. We know that Dandelion Africa supports women, but on the backbone, we have seen an increase in gender-based violence because we were only speaking to one gender. Engaging and asking men what kind of society do they want, and being very intentional in the role that they play, that also does not make the women feel like they cannot take leadership positions, but that they are allies in this conversation. For us, I have seen that working very well, where you're not only talking to young men, you're talking to older men, and you're talking to village elders, all together in forums and then separately. That is one of the ways in which engaging them has been able to be beneficial. I hope that helps. Thank you.
Thank you so much, Pendo, Dr. Joanna, and Isabella. There's another question actually that came in, and are there strategies to include women's participation in conservation efforts, or even women's empowerment efforts, the same between rural and urban communities? What are the kind of regional differences, or the differences that you see? Would you like me to repeat the question? Okay, our strategies to include women's participation in conservation efforts or women's empowerment efforts, the same in rural and urban communities. Isabella, do you want to go first?
Yeah, sure. They're very different in rural and urban. So in urban, you see more of a globalization effect, and obviously internet has a lot to influence and communication. When we're talking about rural communities that are mostly indigenous, where you have no outside connection because there isn't those facilities like multiple forms of electricity and internet, I think that restricts women's access and people's access to information to a point where it really closes down the perspective of the rural people in comparison. So that affects obviously how people perceive their future or the opportunities of their future. So you have to implement strategies that really touch base on their level. For example, workshops that are designed especially for these communities, led by, for example, experts that can go into the community and work hand with leaders. So the strategies have to reflect the perspectives and the cultural practices, as well as the norms and the mentality of the rural people. So you have to very much so involve actors and consider that. So it depends on religion, it depends on the culture, but it can be extremely difficult, or it can be something that is straightforward. I know that maybe Wendo can relate, because African and Caribbean cultures are similar.
Yeah. Very, very true, Isabella. I think for rural communities like ours, it's the lack of access to the service and the lack of accurate information in totality. Then in urban areas, they have access, but they have found, like, for example, in some slum areas, even though they have their phones or access to internet, there's lack of accurate information. And in the strategic initiatives that we set on board has to reflect and be very different in how we approach these two settings, because of the cultural impediments vis-a-vis you have all this information, but maybe it might not be true when it comes to urban centers. So yeah, you're right, Isabel. Thank you.
Dr. Joanne, any final thoughts on this particular question?
Yeah, I think that women in rural and coastal communities have the same aspirations, but the needs may be different and the contexts are also different. So planning and designing programs for both would be different in both. So considering all these considerations, access is actually key. Their access to reproductive health. We always think that the urban women would have an easier access, but it has a different context why it's also different. The same issue for women in the rural areas, that it's difficult to have access to family planning and reproductive health services, but it's a different context altogether when you look at why they are not able to access these services.
Thank you so much. I think that solves our doubt here. We've shot over by 2 minutes, but I'd like to take just another half a minute to really thank all three of you, because all three of you have been amazing. The work that you guys are doing with Dandelion Africa, Path Foundation Philippines, and Women for Conservation is amazing. And today I think I go back inspired, and I go back learning a lot more than I knew. And I'm hoping our audience feels the same too. To our audience, thank you so much for joining us, and we'll be in touch with you for any questions that may have been unanswered, but I think we've answered all. And we will share the recording of this webinar with all those who've signed up. So thank you so much, everybody. And yes, have a good Okay,
Thank you. Thank you.
thank you. Thanks.
Thank you. Bye.
Take care.
Bye.
Bye.
Thank you. Bye.